go to heaven when I die to see Jordan roll, Jordan roll, roll, Jordan roll. I want to go to heaven when I die to see Jordan roll, 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 roll.
Well, roll, Jordan, roll,
roll, Jordan,
roll,
roll, Jordan, roll, Jordan.
I wanna go to heaven when I die.
Roll, Jordan, roll, roll, Jordan, roll, Jordan, roll, Jordan, roll, Jordan.
I wanna go to heaven when I die.
Roll, Jordan, roll.
Well, my mother, you are to be there.
My mother, you are to be there.
My mother, you ought to be there.
Roll, Jordan, roll. Roll, Jordan, roll, Jordan, roll, Jordan, roll, Jordan.
I wanna go to heaven when I die.
Roll, Jordan, roll.
Well, my brother, you ought to be there.
My brother, you are to be there.
My brother, you ought to be there.
Roll, Jordan, roll.
My sister, you are to be there.
My sister, you are to be there.
My sister, you ought to be there.
Roll, Jordan, roll. Roll, Jordan, roll, Jordan, roll, Jordan, roll, Jordan.
I wanna go to heaven when I die.
Roll, Jordan, roll. Roll, Jordan, roll, Jordan, roll, Jordan, roll, Jordan.
I wanna go to heaven.
I wanna go to heaven
When I die.
Roll, Jordan, roll, roll, roll.
And yes, you were saying, Edamasi. Tell me, can't say, yeah, to us, no. You might be a dress in a year from Udin, and what you manner, ye drew so. Upon Udin, idea who near park is a casipa. Will be out to hold Nassa, Yaria, any Udia. A honor be who says Apple Mudi, and who here. A honor be who said. When I be who says Sapum, Dinny, a idea, when you pan, say, Baby, I will not be on your to say, ye can't upon you once more. Hello? Okay. Tell me, I won't say me what until me come, but 17. Apomudi ya idea who here pa. Inti baby a na ye ma lecture bia for apomudi. And make sure say you call them up TB. But I can come and white home pa. And into the minimum ye vegetarian. Na manage apomudi ho pa ye. Abranti or two way. Joe.
Something came on, I don't know
What can was much? Nami no none bobo Toronto as me move ba. There's no single day Sunday abepimiti so me nko ho no nko bobo. To bi kura omokura ye mranche kura me ye akokura for mu ntimi ne ye mbo. Ono we kan kura kirewa. But the make business nyina na say apomudi ya de ahuhia yi. Say obitima sunya me pa na wonya sound mind apomudi ye one of the thing I say ye nyina ye hwe ye pa. Said ye John kitten me a canoe say, we are pious, in a binyade upon what thing, yet you must swing me. And then you'll be a near tree and saffron. And then you'll be a near tree and saffron and say, only a immediate upon the home and come up. Ya, penny Edmonton. Onaso na ye Yenselva School Superintendent Dr. Peter Yamoah. Ono na ene nyame befa no so na yapomuden enkran so no be maye na me stress mama ye nyina ye pay more attention to this because apomuden ya de ahuhia pa me ka se na ye mrantie no se ye ka apomuden ana ye isu se ye ne ye nka ho omo amanyini adus age bi no na apomuden ba ne no apomodin nima akula ya wonene ana wodi mfie mienu ana mfie miensa ya de betima take mu bia basi tie ni ye na ye de bobra se nyame be hye ne hwanu munyam wo ya pomodin ho ti epese ye nyina be ma ye muso bra me bompa na fe matume nsa afre Dr. Peter Yamoah aben mo na fe wa bobwa insa mama ye mompa enyame ni abankese ewia yi ekoso da wase obambo no nhwe so pa odi amayen ye ni agi yie pa de wonam osofo so afutu a odi amayen afa busua ho ya de stage na ne se made yati nyese yeti ne sa akwa na mom anya de ebetsa yakoma mu yadwi mu ba bibia ye wo bia na be sha ase de ye adwuma na itima so abapa amayen iwe ne sa ye de wakoa e hye wonsa nto nyansa ni nhrumu efiri wawrade eninti ye de wakoa Peter Yamoah eba wanim se mano suru nyansa soronko nimde soronko bra oni ye betwetwe apamudin hu enkomoyi wa maye de betimi e de aboye bra wiase ko na wie yare atua te sei yenso ye hu ye nakan ene ya bra ebo ewo sa wiase a yare afa wiase nyina no mu yehu kwan ya befa so tutu ye nan ya boy ho ban afri yare ahoro bi a ewo wiase a yentumi mfa ye ho enkotom bi said ye okan e kire Israel for no se ombe yesitie ne wo tie owrade a omfa yare a wo de ba imizim no emma won so no yenso yes do se bema ye nyina akoma baako ye be yesitie ama owrade na afi wa ma ye nya apomodin yetima toa so asomo no bibia ewo bia ya dansefo ama wawrade yeda wase so bibia sa akwa mayen ewo Kristo Yesu din mu nti amen bra mafi metum nsafre Dr. Yamoah benwa
eni anu ma mo yonkodo nyina so ya de radiase ewo sa kwanya ode maye se ye meti apomuden kransam se SDA sorry oba we a doctor ofie in your own small corner we accountant right we auditor just professions are hodwa owiase no se oba sorry na we ositie ema nyankopon asem a you have knowledge about almost every facet of life. Nyankupo ehira safu ipa. Me wo Ghana no betane professor bi edi nkomo Professor Ajeman Bedu Akosa oye me old student secondary school tie hia de bi obo SDF echi se SDF me pathologist and some of me catch for ne ennyoma maka Utimi koti maame white nneoma waka ɛne apɔmuden kyerɛkyerɛ new start ne adeɛ ɔka nyinaa ada na mote hɔ ɛm sɛ recently yɛhwɛ TV so yɛhu aberanteɛ bi Facebook ɛm sɛ Facebook ɔsɛ yɛfrɛ no Jacob Francis Jacob Francis na wohwɛ ne nkyerɛkyerɛ ne line of thought ɛne reasoning ɛne nsɛm a ɔka na ɛne akwanhwɛfoɔ nkra nsɛm a health message no ɛsisi so pɛpɛpɛpɛpɛ na ɛmɛ ya sɛ yɛatena aseɛ yɛatena message sei so for a long time nipa bebree nim what we believe even to the extent that yɛn ankasa yɛwɔ asafo no mu no woka yɛ health message a na ebi mo sere mɛka sɛ yɛwɔ Ghana no yɛn health message yɛkɔ out ne yɛka asafoma no bi etimi ka sɛ na ewuo kakra mewu nso nti na mo bɛkyerɛ me sɛ minni wei ma minni wei ɛho hia yɛato saa nneɛma nyinaa ato agu baabi koraa but sɛ yɛbɛyɛ very honest said Elder Obed ka no Elder Obed one ne di nkɔmɔ ɔsɛ na ɔnyɛ kwanhwɛni Elder Obed a ɔdi program yɛnim nei ɔsɛ na ɔnyɛ kwanhwɛni na before so ba bɛyɛ kwanhwɛni no all manner of enuane lifestyle ahodoɔ no lead bi one ne di nkɔmɔ ɔka ne nyinaa na ɔbɛyɛ kwanhwɛni ɔkenka yɛn kran sɛ ɔsɛ no I want to take care of my health nti aduane bi wɔ hɔ ayɛ ne dan a ɔnni da nti na wohwɛ no a sɛdeɛ ɔsi te hɔ yi obi anka nkyerɛ sɛ ɔboro 60 years a wahwɛ a wonyi da na nhwehwɛmu ame ate aseɛ sɛ ɔmo de yɛn kyerɛkyerɛ even Japan any countries ahodoɔ a ɔmo nyɛ akwanhwɛfoɔ ɔmo nyɛ Christians na ɔmo de yɛn kyerɛkyerɛ a yɛkyerɛ no ɔmo apply them to their lives no nhwehwɛmu kyerɛ sɛ ɔmo nyini ɛkyɛ na ɔmo apɔmuden so kɔ anim yie paa recently na obi kasa Professor B kasa from China I think so 120 something years and na omo bisara ne secret nneoma aboa no ama watimi anyi ache na wohwɛ ne conversation no man sama no ɔka no ɛne ye message nyinaa kɔ pɛpɛpɛ na de ɔde to aso ne sɛ enwe yɔnko ho adwen bɔne ɔnyɛ kristoni o ɔka ye messages ni nyinaa ɔsɛ nom so have very good sleep sunlight exercise ɔka ne nyinaa na afɔ de twa ato sɛ enwe yɔnko ho ade adwen bɔne kakra bi a obia na mo ani nso emu ani mmere obi ade ɔsɛ no na aboa me finished wan quote bi in free bible mu ti we me ati asɛ sɛ take a health message ni serious a ɛbɛboa enyam sem kɛseɛ tena so ɛna yɛboa Jacob Francis and no bi catch so millions of followers elder na me boa we say about 15 million or say 10 million apart from sika obenya de free mo no hwɛ the impact na say no bi kura suggest say Ministry of Health employ no as Director of Health Promotion because in Yamoah me ati say if promotion very seriously ebe reduce the cost of health care because so share health promotion here sa yare no sa nneoma no eso bete e hospitals a health care cost expenditure spending on health ebe call from bed ahodra you say a bed ni ho also call temani all e go ho no all away bed Empire Hospital dem so because go hey any ehwa no mototo nam ni ade ankrofo ebeto de ko omo kore saa nam ye ombe yare ye be rush omo be emergency ye be kona bed ni ho ti we me ati assess ye for health will be less pressure on our healthcare system ebeboa ama healthcare delivery akoso enti enuanom ye mfa ye health me sure dwumadi na asena me akan bibia free third John say the bed eti ho kakra bi kire o say third John just one book just one chapter until kind verse 2 and I say beloved I pray that you may prosper in all things and be in health just as your soul prospers. O say anuanom me mu paye say mo be koso e wade nyinam na ode apomuden e kan ho nti it means that say apomuden enwie ya yenya som eso enwie peye nti ene me da meeting planning committee for us and the health committee na say mama me akwenye say me ne mo matwetwe nkomo about hypertension. Name me bedru and me who say the stroke. Me the stroke ho asem ketwa bi so ehiem enti ye bedi no so ho nkomo ketwa bi. Eye ade a ehho hia se ye hye no so hypertension they say ate na nipa bebre so omanya hypertension they don't know they have it. Eno ne ade a people are just walking about, their blood pressure is on the roof. Me kasa me Ghana, Dr. B Juma, consultant, I will treat cardiovascular diseases. Ye jina ward, ward rounds, I kum, when muni ashe form. Say the stress nyasam get free. Ye hoa, na me konfa noche. Or pon free konfa noche. There are other places here, or say kwe Juma. Into obeba no pano, why so stressed out? Yeah, ward rounds. Kum, womuni ahi award ho. D4, or not that hoy. Hey! Afei, omubefa no korane test a hot door checking the blood pressure. The blood pressure was over 200. And so a consultant, cardiologist, or shakumayari. Afei, one some, and then more stroke at the hobe gym. And ni afekrama na ufrim. Or a doctor kesiye pa el konfa noche, but ufrimu koe. It says usually, especially health professionals, no. Ya jwe say ye can messages no chira man for na ye de bi nye. So we neglect checkups as ye jani nyina ye nye. Most of us ye nenam ye tiase wu for. And ye nenam we don't take our health seriously. And now no pay me ye say me check my blood pressure wa ha. Na me check me yemhye me kakra. Me check in nra na me check in ne. Afei owie nra na atra 140 me say eh na ene so sa ye bio a 142. I'm say hey. Na me te ho ka na I'm say pa na say me na no enko ye papa. Hey, osofo akoka bibi o. O man prescription. Okay, me da say. Be free ha me kwa akoto aduro no. Enti especially maybe presentation nra me koda na about 2 o'clock because na me person me research na me share stroke no e de kan na fe Canada ekura omo hwe omo treatment guidelines ye omo sesa no from time to time maybe ba ha 2023 hypertension guidelines are no more use no masesa no they say 2026 mun away last year omo sesa omo guidelines for hypertension ne other cardiovascular diseases. See, almost every time, no, they are researching and then bringing out new inventions and thereby with treatment outcomes. See, may yet search many times on that time no call. Most of us so ye na. Enti sa nneoma ye bebo so nneoma e haye ema yare etimi ba bi ho haye hu putupru na afire de ekọ. Enti outline of the presentation and my show was slide no so no ti. You ever heard the definition of hypertension? You do baby so ever heard stroke so kakra. Afi epidemiology and also statistics. You ever heard facts and figures? So you say you're Canadian, you be use Canadian figures. Afi you ever heard the clinical presentation. A quite bena obefa so obehu a silent disease. Untimi hu say when ya onam hosa ba na blood pressure na high, but there are certain markers via ebe boa mo etime hu say ABL blood pressure a cosro. After risk factors and numa hodo bay and a predispose ye who say a likely say ye no you bet me high blood pressure. Ye beshe. Now fe ye free risk stratification. Ghana ni enye sa ade but Canada omo ye treatment na. They don't just look at your blood pressure to give you the treatment. They also look at other risk factors like your age. For instance, or you're greater than 75 years older. That's your blood pressure, no, above 130, they see you as a high risk. But will be only 75, no, so 130, and the risk low. So age, they look at your kidney function, and then your man who be at the count or blood pressure no reading now when you know at the treatment. You ever heard and management. A quite young can quetry because a no dose you the first line treatment use for Canada and the side effects of the drugs. So there will be UCBA we use say drone bia obehu side effects no na aboa no afei lifestyle modification enioma ben abrabo ben na ese yebo na boa say onum aduro ana say ye nyanya bi no then na ese ye say the be ya ye predisposed to hypertension and stroke. Na afei ya hwe conclusion. Hey, I say me hu ni ye papa. All right. Pamcho. Mr. Mofancha Mekakra. Basis. Okay. Inti you ever heard the definition of hypertension? Inti definition no. Also hypertension is defined as persistently elevated systolic and or diastolic blood pressure. Inti if we be systolic blood say o tena se no mo chechire wonsa na won say reading no ye wo estro de and ye wo efom de. Thank you very much. Okay. Thanks. Ubon say be ma reading mienu estro e de baako efom de baako estro de na efre no systolic blood pressure. Now, systolic blood pressure, no, the blood pressure when your heart is contracting. Akumano, juma either say a be contracted at one point in time, and I say a be relaxed. A contractor, some na a pushy mojano at the court nipedua aqua ninemo. That is a contraction phase. And after a relaxation phase near the time, akumano air fairly moja a free nipedua ahod aqua ahodomu. Two phases. It is systolic no ne estro de. There be an estro de no etai eson. Echen a form ediano. Inti so picture am show ya. If the open kuno the systole phase of the heart pumping. Ti ho sa pressure no na ewo estro no. To hear say arrow no show say moja na dey a piefri akomanum. I had to say sebe nim bentoa say the bentoa say whatever it is a rub bento na umia ama nsuo no aba bonten and I say whatever is in the bentoa no enema no aba bonten. That is a systolic phase. Not just akoma no boden e de pushi moja no e de pie enti say bibi esi unipadua kwa na ntininum na moja na ntimi emfamu nkwa. The heart has to pump very very hard and sana moja na ntimi epie, especially omo disra de nam na afi omo ntininum asisi no. The blood the heart has to pump very very hard and sana moja na ntimi afam to bo say the systolic blood pressure will be very very high. Ti yebe kan so ho asem afi de o nifa so no and the diastole emra akomano relax and I say moja efri ni pedua na kwa nom eba de aberem no. Inti what is normal blood pressure in Canada there based on their 2025 guidelines no. Hypertension is when the systolic blood pressure is greater than or equal to 130. Estro there no. First I made back Canada in 2023 na higher than 140. 2025 guidelines almost sano at the about 130 because research on we shows say more 130 and below no more outcomes better more blood pressure no 130 and below no there complications they say stroke any retinopathy and pneuma hodro but the moment a bedroom 130 na shall say afrakono now I shall say enya complications right initiation also and I say from there no say 80 or above and also so more categorize when you hypertension. But obi oha a form there can be lower than 80, but a stroke there can be 130 or more, and is also classified as hypertension. She says a form there normal, next stroke there 130 and above, you still have hypertension. Yen can say a form there a stroke there or stroke because a stroke there is very, very important. The systolic one. After you be isolated systolic blood pressure, and only elevated systolic blood pressure, and then normal diastolic blood pressure. So they're not making isolated. Not just say it's just the systolic one and a osro, but a form the very normal. Still blood pressure isolated. After you be white coat hypertension. Nipa bi wo ho a wodi duru hospital a wo doctor white coat no pe na ne yema hye no ti otena se sen wo measure ne beep no se be kosoro nipa na bebre e was a problem and no we don't classify it as hypertension. They don't usually require treatment. Just the circumstance. Minim de entia, some people get anxious when they get to consulting rooms. Even actually here akra nipa bi tena ase a omo yam timi hye omo. Yeah, no more higher impo. Doctor Populampo nom check it. Ye ni mo so mo check here. Na yakoma etu. After you have be masked hypertension. Normal, that is normal blood pressure in clinical settings and elevated in non-clinical settings. Obi also go hospital or check here e kama. But kodru ne fie no no e ko check here. Na fe e kosro is the opposite of the friend say white coat hypertension no. And after you have be hypertensive emergency. Hypertensive emergency no blood pressure and I could do systolic na do best 180 and above. Right? So drew 180 and above, it usually leads to end organ damage. A bit damage your kidney, a bit more damage your kidney, a bit more damage the retina of your eyes. If you write to me echo blind and I say or move vision no, it's me a basa. Not just say it's a sign as a show say blood pressure no it's likely say it's over the roof. And after hypertensive urgency, and no blood pressure no cost, but there is no organ damage. Organ beer and say it. Usually be all hypertensive emergency. I see a ration straight to the hospital. It's an emergency. We don't have to wait because it can lead to stroke. Usually it's a cost sana akomano a body sa. It me pie blood vessels na edi moje ko adwin no ye ka stroke e be ka ho asem e koso say be pie na fe moja na enwuna gu trim. Aside from that no so wadwin enya the oxygen and the nutrients ne ade enoma enam droben no de ko adwin wunya sa enoma nti bi mutimi nya convulsions any other neurological problems. Yen epidemiology so here Canada higher. Human say 8 million of Canadian adults have hypertension. Now Canada yes, I think say 40 million. To far 8 million is about 27%, almost 28% of the population have hypertension. Now 8% of the young adults, 20 to 39 years, have hypertension. Hypertension yet in young adults, 20 to 39 years, 8% of that population. Afei, ufa omo 60 to 79 years, omo ehona dodono about 56% of that population hypertension. Now, afei, about 90% of Canadians will at one point in their lives ebenya hypertension. 90%. Enya sam keto 90%. Adia ha adwin ye pa. Ena ofo momonya hypertension na only 42% are adequately treated and controlled. Most people, about 42%, their hypertension is not adequately controlled. After a clinical presentation, said I must medical cano. it is usually asymptomatic. Asymptomatic, I say, one and I'm hoy be beer normal but blood pressure is high. Now complications be better one who say blood pressure is high. Now medical be so. Stroke one example. Say the drobene did moja kwa adwunumu bitimi paya itimi onya stroke. Never heard the symptoms of stroke as we move on. After ye free be hypertensive encephalopathy. And on a bar, and you remember more who's when you have condition, a confusion. What now has why confused? After headache, convulsion. What organ almost a strakano. Meaning, baby, I'm going fast that term, if free, but elevated temperatures or temperature not try 37, I call 38, 39, and a day convulsion, no, eba. After elevated blood sugar, hypertension, diabetes, or more link, kesiapa. Diabetes between when you hypertension. Hypertension is between when you diabetes. And I have a hypertensive retinopathy. Drobene dimoja ko ye nisono. Say blood pressure no ko higher, a bit me pie. Say the wide dream with a pie. That's a be pie, that's a be hardened. Right? Inti a be ma vision no because enuane no so ko ani so ne ade no nyina wunya nutrients no nyina wunya ti affect wani. And have a heart attacks and a kidney disease. Risk factors. Ye frɛ be non-modifiable risk factors. No. We are here. But modifiable ones no there. Who would suit to me say obetimi control. Until age greater than 55 years. So Hannah would bro where the 55 years and above or risk is high. After gender, hypertension is very common in males than in females. And after race, about race so is more common in blacks than whites. I'm saying before you huna mane pao. Bibia na enyae. Why? No people say a question. I'm say ade ba ko edi kan genetic ahwehwemu am say genetics. Ya wuso mu no. Ye fa sa trait no. The blacks high propensity some blood pressure because and after health seeking behavior. Yeah there. Usoro na nam ho na odidi na akoba wadwene say bibia ya okay ye nko check up ye nko hwe na afi environmental factors aduane a ye di nsu a ye nom frama ya home ni ade me kai say me ba Canada me ko ye eye test e wo optometrist bi ho Collingwood afei me ko ye test no the machine hwe mani so a say hin na ofiri ba me so me free Ghana o say ho futuro ho pa ho say hey and I'm saying, "Ade," or say, "Who you be when it seems that futrafo and iswati a be accolage." Say, "Wow!" And as I mean, Kobio, me Kobio and futrafo for many so any makaya. And I mean, Sanko. And a family history of premature cardiovascular disease. So, Busiemu, Papa, Mame. And as a nana close relative be say less than 55 years for males. So one nana be an papa no less than 55 years. And no nya hypertension. And as a mame no less than 65 years. No nya in Canada Canadian guidelines no there we are likely say usubetimi enyebi. Risk factors and nyoma yebetimi also to me I yebetimi ayena a bit Emma hypertension, Emma yeso. Ye free modifiable risk factors. Now smoking, tobacco use, kroma, krofo smoky pa, because me jumem, a drew almost smoke break. They drew hono munyina, I say, ya bope. No more smoke pit, no more draw, no more smoky. Omo bombs, na ade, smoky, no sound, ya ade, nipa bear now. As if say a crime. Say, wow. Smoking is also a Yamoah award. Smoking is very, very common in Canada. Now, I did have second-hand smoking. Ebia, why do you also numbi? But obi nom, unimobi or numbia. Don't get close. Timmy Jumam say the smoke pit, men for hot. Because the first day I'm a far honor from a farmer, so not a noshi. To be decided something for hobby. Because you can be a second-hand smoker. I feel poor diet. Me back can meet you. People say, and then ngure. But I don't need no. ewurawura no eno ene enioma ebema ya pomuden em se bi mu ba ha ukọ Ghana ubedru kamis ne nkrofo ka mutuo ne ade banku it's as if say omo ofie no mo ne di yesra mo ye ba ha se ye be bompae and moreover enuane no mo ye no ha no especially enra manko dinner there but breakfast na lunch we say lunch no na mu ha pa o omama friend say oatmeal and opa omo de egg aka ho so afa awia no ba no omo say wa betena se wa bre obekọ na nwura no dọọso omama okabo kakra bi but Ghana ni mpe opeso odi jollof eno kro mfa hwenka ho raw ana say anwamu na anwa ya no chong o say yes medidi ame carbohydrate nko a emoaye afa high sodium intake yemu bebre we are taking in a lot of sodium especially ya to abo aduane wa bonten no any carbonated drinks no there's a lot of sodium and afa enuane mo prepare na bonten mo de monosodium glutamate the friend say maggi no it contains a lot of sodium. Now sodium ya there attract water osmotic effect until you do a lot of salt the body is going to absorb remember to come out there to benum so bebre na fe absorb a lot of water into the blood the more na umoja no doso onipadua moja nsuo no ama moja na doso no the heart has to pump very hard to push it because adoso nti ye drew treatment abonze no ni bi ho ya the mawa eboa ma ojonso so the be reduce the volume of your blood now reduce your blood pressure it's one of the neuronal mechanism de eye adwuma afa sedentary lifestyle you bi ho exercise ye chiri ye nye exercise no as ye te ho saa na ye overweight and afa mental health stress if you want me who says stress ya there it is almost associated with every disease talk about ulcer stress is there talk about diabetes who stress almost every disease is associated with stress including hypertension ts remo yen hwe yen na yie yen home sika permit say so for can mortgage ni ade bi hu asem yen very very careful because saa nyoma no affect ya pomuden ye set target kese ema ye ho na afi yakoto yare de ama ye ho menka say ma ye empe bibi na mom yen set a realistic target and let's lead our lives one day at a time the nyame de shroud in your current state no mo so but work harder towards what can also be achieved moderately on for pressure on top pressure ema ho afa medical factors poor diabetes control chronic pain say we obi a chronic pain hwema me say pain ya there e cause stress now the more stress na ba so no na afa blood pressure cause afa non adherence obi ho a adura ya tra man so onom na say mo ho elder be frame from Ghana me blood pressure na cause ro na am say adai o say duro no de man no obi say ba akwati ma obe ma ko form pa na minim miensa minim which is which to be the majai ni nyina cause ade na hia me papa say hey and I'm saying now check here and so say duro be 160 say wow and I'm straw sha say na nom na otwa na duro no kire me say bia so ni ho na cause sa ade no o de send him say enura ono na bia ni ho say ne the nkrofo kan no say me ho badwojo me so unim say aso pani as I said mitimi de esa me ye ma said there say Ghana amofo no onwum bi say me ye ma said say bury ma omo onwum bi omo to tem say bi mu de ayo omo antem me ye ma said say bury ma e wa abusua mu de ende omo keka nsem bi sa eti we jai na duro nyina to ho say oye koye na said say bury ma very very serious afei obesity keseye enya depa and also associated with a lot of diseases. Afei free baby says sleep apnea. Sleep apnea no omo tonsils. Obi the tonsils are kese and say structures no respiratory tract no bi are enlarged. Nti okoda na dwo a ontimi enframent mi emfa na airway no mu yie. Ehwehwemu am ye ho say saa de no. Obi obozo home 10 seconds na enframa na san atwa. because of sa blockade na wo ne minimum ho no bia ne tonsils aya akese and as structures no respiratory tract no ebi akoya akese and as ebi ho atechema eno so timi ma blood pressure e cause na a lot of chronic diseases also raise blood pressure because of the stress de to nipadua no so no afi enu ahodo bi aye nom especially omo pe cafe no madwuma say omo nom pa obi ha oba flask ekura no e coffee no gugu adwuma ho to ba no answer wa hye na ma obenom no saa onom no ko smoke ba saa smoking coffee saa no mo jonso saa nyoma no etimi raise your blood pressure caffeine afei NSAIDs yeah painkillers to say diclofenac ibuprofen bibie no ara akoto ibuprofen had the untimi unya uni prescription untimi nya ba ye ekuro mu Ghana de crofo overuse and some abuse non-steroidal anti-inflammatory drugs yeah to say diclofenac ibuprofen indomethacin Advil no ana ibuprofen no enti crofo abuse say nrei na hwehwa me say etima blood pressure costro afei oral contraceptives Chrome her contraception a big thing. But who are 12 years, 13, no use contraceptives. Sa contraceptives, they are steroidal in nature. Now, sa steroids no a bit a form hona, maybe can ho asemi. Oko Ghana so a nkrofo nom dexamethasone, especially man on my own. I'm friend, is it D or whatever P? Prednisolone, dexamethasone, no more nom. So the bear omra no I can say. Ni aka say, oh. Or where no I come papa. We name the auto amount. Sanrono, they cause fluid retention. A lot of fluid retention. Namaka say the pediano fluid air retaining when the pediano more na raise blood pressure. Afei esan raise blood pressure no. Esan so it decrease the uptake and utilization of glucose to blood glucose so cause steroids increase blood pressure. There's also increase blood sugar. After stimulants, hormone, cocaine, methamphetamine, nicotine, need the keka home. And as St. John's Wort, Chrome had a common, Crawford treated depression, a herbal medication, and Crawford a treaty or a depressed that. Or my dream say a herbal until no any problem. If you want me who say, oh, facha, it me increase blood pressure. But can be about risk stratification and near doctors no eka o blood pressure and cost no mode treatment. The established cardiovascular disease. And hypertension cardiovascular disease. Yes, be coronary artery disease. Now coronary artery disease no the say your artery be and I said droben be a moja nemu wakuma no and the supply wakuma no wakoma na nkasa so hia enuane nro hu se air pump moja ne ade no ono so hia hoden ti nyankopon ye blood vessel bi a eno so supply akoma na nkasa with blood and nutrients and other things a friend of coronary artery na edru time bi a there is an imbalance between the supply and the demand so onto bu ha nante kakra bo sama bre ye frɛ yare bi se angina pectoris Ubuha or fro, even stairs are gentle. Stairs are kakra bia. Ubejina wa teso sa. And no, it's a sign, one of the signs that say we are in a coronary artery because there's an imbalance between oxygen demand by the heart and the supply. Supply na nyanu so chain the demand. Akoma na ye adwuma but oxygen ni nyanu no na hia no enya. Nti your friend coronary artery disease. After your heart failure. And your cerebrovascular disease, a bit to say stroke, no. Ubi also or senior hypertension. Doctors not differently, say or different risk category. Munti, be inform the kind of treatment to give or a high risk person. I face nipan or diabetes, no senior hypertension, or no say a high risk. I feel be all chronic kidney disease, or senior hypertension or high risk because. Chronic kidney disease and also 8 blood pressure costro. And I feel greater than 75 years or more than 75 years. Now hypertension yedoto risk group for Frobikram. Yehwe management, a ben na doctors fast to treat hypertension. Canadian guidelines about 2025, and almost say if the BP is greater than or equal to 140/90, or the systolic alone, the systolic near between 130 to 139, not even diastolic near normal. Now, some risk the above so bia. The almost said there must be lifestyle modification and treatments. And you want me know, Dr. Anabeka a lot of lifestyle BS. Lifestyle modifications as we move on. Now, if you are monitor every 1 to 3 months, Mestre say any blood pressure monitors. Yen to be here pa. Utai measure blood pressure no we check here. You bet check when so check blood pressure. You be accurate readings. Utai check here eboa. Eti blood pressure no say between greater than 140/90 or systolic near 130 to 139. Not diastolic nimpo normal. Doctor no now also risk factors boss here. The doctor will put you on medications and give you lifestyle modifications. BS oshe na eboa. Now, if you are monitor 1 to 3 months until the target BP is reached, say it should be less than 130/80. To do that level, now if you are monitor every 6 to 12 months. And if the systolic BP is 130 to 139 with no high cardiovascular disease risk, to say age greater than 75, chronic kidney disease, so we need pneumonia be now blood pressure elevated above 130, systolic elevated above 130 up to 139. And no doctor no ma drubia. Obema observe lifestyle modifications without any medications. If you don't have any risk, bia sana obey na fi wa assess so every 3 to 6 months until say Ubehun say atra 139, echo 140. Omo need any risk factors. Now hypertension no. That is a protocol. And if the BP gets to less than 140/90, or the systolic BP is less than 130, and there is high cardiovascular disease risk, promote healthy lifestyle and follow up every 6 to 12 months. Our protocol see omo ehwe ni yi Canada hapa. Yen hwe kwan fast measure BP. Nipa bebre omo measure BP no wrongly. It obey no so adena say me ye consistent. Obi timi ye o say me ye first one na 130. Beside second one na 150. No gap no very wide. It means that there is something wrong. As I said, share because it should not be more than 5. As I said, more than 5. The difference usually we check it first, second, third. The difference no is so wider. Either say machine no problem or one. I say a kind of fast so a measure BP no, and also problem or one. Where steps I say when you also relax in a quiet place for 1 to 5 minutes before taking measurement. Do not talk. And they would do a bimu measure blood pressure no more kasa. It's not allowed. So we measure blood pressure. The hona we kasa tintin. As I said, we relax it. And I said, kasa for 1 to 5 minutes before taking the blood pressure measurement. I face sit in a chair with back supported. And so we're chin supported. Tia kunya a chin ho we're chin supported. Don't sit on it to take your blood pressure. And your feet must be flat on the ground, not crossed. Yes, what not cross 09. I said 09 no flat on the ground. 9 is for mankasa. And I have no caffeine, tobacco, or exercise in the past 30 minutes. Example, running to the doctor's office. Would the call doctor be office say, on check your BP mawa. I hope checking 160. Because hey, me but entesa what nase homia a beba form. And I ensure the calf size fits the arm. Calf na ye a boy and sa a check blood pressure no. And kofa calf a hen ha on sa no. E say e calf and no on sa no size no efa. Because it should be able to cover 80 to 100% of the arm circumference. Your whole arm circumference now. It said to me cover 80 to 100%. I say tight. To cover BBA as a hinha on sana. We are being wrong readings. and our arm should be bare. And the someone say shirt and I be a shower. And so bobo on and I say raw shirt no. Now arm na bare, I say bare, say bibia when the say tadia na bibia on sound. And then take 3 BP measurements at 1 minute intervals. The best way is say don't just take one reading and conclude say my blood pressure is high. Just one reading. Take about 3 and then take the average. And then do not measure if stressed, cold, in pain, uncomfortable. I what do no I now so check. Now check your blood pressure. It's going to be high because the heart is going to pump blood to the extremities so the be warm. In so doing, no blood pressure a be costro. And I face a Jones what they were. Your bladder must be empty. In fact, bladder is full. And now say, oh, check your blood pressure. And also be wrong reading. And to share picture over here, say there a branch to way. Say, and there's our transit. A measure, a take your blood pressure reading. The back must be supported. Your hand must be at the heart level. So now, say a da at the so flat. Now, if you want 9, so it says, see ho. Say, you take blood pressure. And yet, the other way around, yet the branch way, they are very, very wrong. We see the trace. I feel that we're crossing a 9 Yamoah of taking blood pressure, and I send a 9 million in ICC form. And they were wasting the trust and what food and sano. It's very, very wrong. Yenyanasa. You have lifestyle modification, and you might ben as ye na ye share na a boy the modifiable risk factors, and you might own to me. They decay weight control. And then I'm in a health team, no air can which shows that. Yeah, they check blood pressure, read, you check blood sugar, but we need to do BMI. I'm saying that, I said, the Nipebia shall see be very important. And your weight divided by the square of your height in meters, right? And to say, so weight, let's say 90 kilograms. Now height, 180 centimeters. The centimeters will be converted into meters. Now 1.8. Now our square, no, 1.8 squared. It's another bar form, another denominator. Then the numerator will be your weight. So the weight divided by the square of your height in meters. Now I don't know a meter squared. Until when your unit in kilogram per meter squared. Well, yeah, the normal value should be between 18.5 to 24.9. That is the ideal BMI. So we try 24.9. You could see 29.5 we are overweight, right? 24 above 24.9 to 29.5 we overweight. I say between 30 to 32, I think obese. What I say obesity. I say now what try 35 above 35 we are highly obese. 40 they not just say con yempenokra. And your friend is also waist circumference. So, I am say tail and or the tape to usisi. So, I check your waist circumference. No, Canada waist circumference I approve for men. 102 centimeters or 41 inches. To what now weight more than 41 inches. When you say somewhere at all, you are in trouble. And we bar so or there 8 to 8 centimeters. What the core inches 35 inches. There's a man the obese for no pa. Obese. I feel there twice smoking cessation. So smoke here. You're very, very careful. Nancy and I mean Madame we or back another hand chair or so sorry be my sorry minim a sorry crow. I feel Osha for a collection and this canaba also pie abonte so be here no go dura abonte ho a o sha na gina ho a o smoky o say hey na nya brantie na no ogi collection no o say ha o frame na o ne me ka ho asara say minim de me ma sore de me hie o say asore na me ko ere de mo o sha no we pie abonte ko smoky o enti ye mu bebre ewie honom san smoky enyo bebre say so I feel be the DASH diet, and I say a Mediterranean diet, and only more of fruits, vegetables. I said, "Ye dema or la kumbu low fat dairy." also forcing. And I mean, no be share. Me call down a journal. Me share woman be was hey. I saw for you come here jollof more. Kabebo and ngure de more. I'm say we are sure. What busa I saw for na mama kasa achro. I say I'm sharp because it me be bisa they be a kopena ntwi nambi. That is shame. I'm say mesrao. Don't kill us softly. Yes, rawa me anwura na sa. Fruits, vegetables, low-fat dairy, dietary fiber. Yemu bi ho a aduane a fiber o ye ni. De aso ho no nko na ye die. To die na o sugar spike. Ha adwen ye pa. And animal protein. Yente animal proteins. Na ye ni more of the friend say plant-based proteins. They say beans, soya bean ne de keka ho. Ye ni eno no more. Physical activity in Canadian guidelines, this is what they recommend. At least 150 to 300 minutes of moderate aerobic activity every week. 150 to 300 minutes. Until over 150, no correct means so we have 5 days. Every day, so you have 30 minutes for 5 days minimum. But you must say you must do say no. Now exercise no interest ko peja da de. Nantie keke. Walking about, you can walk around your neighbor and I say, "Ufi out to betima fro stairs or fro na usane for 30 minutes." A exercise. And kopeja that there's no who say oh exercise. After a reduction in sodium intake, in Canadian guidelines, the recommended daily sodium intake less than 2 grams. Less than 2 grams, about 1/3 of a teaspoon, the whole day. But now restaurants ni enyuma edru lunch a omo de enyoma bi besisi table no so na omo abobon tokro bi wo so na omo hwie gum say hey e be spices e be salt na aduane e de ama already na be salt wom na omo san e de gum sa no so omo hwie gum, but the guideline am yehu say you need just less than 2 grams of salt per day. Na fe ye de magi no aduane no eno so e contain monosodium glutamate no sodium wom maka ho asem na fe e kan ebi so de kan no aduane pa omo so omo de no na ayemre very very dangerous e kan eno so ebetimi contribute to high blood pressure. Na recommendation no chere say you increase our dietary potassium. Potassium ya de boa komano pa ma na ye dwuma yiti. Ye benya bi from fresh fruits. Aha de eti ye okọ Ghana ope fruit edin o. Se season nru ho a minimo bi as a mango bar or take mango no be say bucket bi on friend say 34 a day no. What take ma not hu di. O say ha me ni bi ko be ko. Also yenya na sa. It must be balanced. Say mango bar obey no ho dia na onya diarrhea because fiber no dose na afa ne yam say pen na be ba no adi pen kwa no yenya ne sa say onya bia o nutrient ewom say onya bia kakra o balance na out. Afa relaxation therapy say dey aba hai enya say ye ma ha say be da, but wo hwe environment na very cozy eboa relax ye ma blood pressure form. Nti yen time ra come meetings and I say yenko ye free be a better beach. Okukọ sa mia ho na ko take deep breath. Na fe wo hwe nature eboa ma blood pressure no easy form. Ye hwe treatment in a very short while. Ye the presentation be very easy. Recommendation Canadian guidelines no dey man say there are 3 major treatments. Neuro classes miensa bia. And not there, omo establish their first line treatments. Now, first, me ba Canada for front. They no use one. When you have hypertension, they just give you one out of those 3 medications. So, and yet they will just be increasing the dose. So, some bedroom maximum dose before they switch you to, or before they add on another therapy. Now, no, they say, hypertension start with 2 of those medications, low doses of 3 classes. na fa low dose of 2 of those. And no yet say over for high dose of back no side effects. So that is the logic behind the new guidelines of the BAR 2025. So all hypertension alcohol hospitals is here. You realize that they will give you 2 medications. No doctor will give you 1. Maybe 2. To say 2 no, if and format, then another one will be added. I'm afraid of triple therapy. That's a miensa. So miensa na anya juma. There's a 4th one that they will add, but I don't know side effects. Make them. It's the first class of medication from the thiazide diuretics. And no my mouth so. So me catch them say blood volume no cosra. O blood volume no say udi sodium bebre atwen so eba moja no heavier. And I said dose one. The heart has to pump more to push it. In that light, no, pharmacologists no so atna say who say so mo de edure be mo adwon so a eba emawa etimi boa reduce the stress on the heart. Reduce the load na heart no eba heart no so a pump pushing out no it reduce no. Now the mechanism of action is it increases the elimination of salt and water in the urine. Now the side effects low blood potassium or potassium or junso in so to go no na potassium so fa hon echo. Usually when they give them these medications they tell them to take potassium rich diet or potassium supplements. They give it in addition. After my blood pressure also to me eba format once. So usually when they start treatment they give it at night because blood pressure above from it you dizzy. But the man na jo akoda na ofa there. But after a while, you become very normal. After a while, maybe some 3-5 days, and then the paduana jia, obey okay. After a low blood sodium, it's not say a pushy in swony sodium, a contain so sodium so to me echo form. Now after a high blood sugar no and so to me a says a spike, but they give it's a low dose of that, and they will add another on top, so the bear and causes side effects. And after high blood uric acid. Uric acid, and then the cause rare, a monia be a gout. Uric acid, a cause through bibra, a more red meat, ni beer no, and my uric acid cause through. Said Ray, so for high dose, and also to me, uric acid, no, it's me cause through. Because of that, now they give low dose. And after the uncroform person better, no, sexual weakness. I'm saying, we nana elder no sruno, but ni 3 years, ni the end, and I will be encountered. There's another class. This is the second class. You free almost AC inhibitors, and I say ARBs. So class is also examples. Na mabo so lisinopril, perindopril, ramipril. Ni na won't say pril bi so pril so unya dra pril. E twatwa e sa class bi e ne atro e de amount. And after the ARBs no so your candesatan, valsartan, ibersatan, almost satan. And yes Satan. Anya bonsam Satan and so and also eso. The Jumedia omudine say omo relax blood vessels no. Na fe omo reduce hormone bi oni pedue friends aldosterone. Aldosterone no Jumedia say ADN say retain salt and water. Until once you're able to block that pathway now, salt and water will be eliminated from the body. Now fe ama blood pressure no akofom. And also to me cause sexual weakness, but very rare. To me, yet what to so I know. Now the side effects no be so high blood potassium, low blood pressure, hypertension, and I feel you free be angioedema. A very rare angioedema. You have swollen face, swollen tongue, swollen lips, swollen throat. Offer nipa bears 100,000 nipa ba open a rare side effect. Until any day but. Side effects, you need to report. The doctor has to change it. And that's how to also enom. Now, AC inhibitors, no, are thereby also a dry cough. To be on AC inhibitors, no, dry cough, they are switching to the ARBs, the candesatans, the valsartans, the ibersartans, satan for no. I'm going to do also dry cough. But lisinopril, perindopril, ramipril, propofol, also dry cough. After the last class of drugs, they from calcium channel blockers. People say nifedipine, amlodipine, almost pain for any trap almost two. And the bemo who said, "Sa class in a day be a mammy." Then also the air and say a beer nipeduentino, mamma mojet me fermuntem. But yes, I know not a cause headache. To her side effects now, headache, one. And I feel free be peripheral edema or nancy bit my tatai, kakra, because a beer intinu mamujano firm is sanaco. The bar na ma on sa or nancy titru atata and a free be gingival hyperplasia. And yeah, rare overgrowth or enlargement of the gums, and also a rare. I feel the chato a draw where me say the fourth dragger said 3 no anya juma year or mutimi add on to those 3 no. If you're not spironolactone, and also our side effects usually no and fang unless your blood pressure is not very adequately controlled. If you do well on 2 or 3 of the medications, you are okay, you are good to go. And because also side effects, usually we try to stay away from it. It can cause irregular heartbeats, low blood potassium, breast tenderness, especially men the no foot it's better to go to heaven with one eye. So blood pressure because shoot to when you stroke or no for boss you. And your breast cancer denibia. And also cause erectile dysfunction. A man and mama holding etimi ecoform is one of those medications. Beka bibika krebi about stroke near the presentation aberry. I'm say atanasi abre. Stroke meka bibi say stroke so there or blood pressure cost rate me the ba. Now apart from stroke, there is also another disease related to stroke. A friend transient ischemic attack TIA. Oh, what happens when you saw your tumor twice bisa. Now I don't know last for less. It should last for less than within 24 hours. Now, as I said, try 24 hours. Said try 24 hours now. That's what experiences are there. It means it's actually leading to stroke. A cancer stroke. The TIA here, the mild form of stroke, transient ischemic attack. And when you subay tum, now fair so TIA we are din pa, but a very transient, usually less than 30 minutes. Now I feel okay. But twice over 24 hours, you need to seek medical attention. It means that something is going on in the brain. Either say, droben and nam adrenal maybe one pie pressure na kosrama, it be one pie, and something is actually happening. The stroke will last for more than 24 hours, and a TIA will be less than 24 hours, but usually within 30 minutes. There are 2 types of stroke. Your ischemic stroke and then hemorrhagic. Hemorrhagic na droben bi ho be pai na afi moja nwuna go trim. Na ischemic na de BBC entina moja no enam mu de kɔ no nti moja no ntimi mfro enkoduru adwen no ho. Pacho ya te ase. Your ischemic and then hemorrhagic. Hemorrhagic na de blood pressure na akɔ so nti apai ama moja nwuna go trim. And then the ischemic type na ye bibi omo pesra de na na say moja bi enwuna gu nipadua no ama aklot intini no bi mo moja enwuna gu intini no etimi klot o intini no ti moja intimi emfamu entra enko very very dangerous. To hear picture ya ewo ho ya we one a bit much which type of stroke this is it hemorrhagic or ischemic? I don't know hemorrhagic. Clot, pacho who clot home. Yes, and to way dear here. Is it ischemic or hemorrhagic? Hey. Pacho, mo am say hemorrhagic, mo mama onsaso. Mo am say ischemic, so mo mama onsaso. Okay, let's now go to the next slide. Na fe mo judge. Ti mo hwe wo hwe benkum so ho abaako wo ho. Wo hwe nifa so so abaako wo ho. Nti wa che emu mienu. Ti de na hemorrhagic. Nifa so de na hemorrhagic apai. E na benkum so de no emu asi. there's a blockade. Ti moja ne ntimi nkonkudura adwene no ho. So your fellow said cerebral artery. Artery na de moja kwa adwene no ho no. Emu asi anasa apai. Ti yenhye saa ne omayenso. Yen a pesra de nam cholesterol na build it up. Emwa saa emwa nipadua no stroke ho kra. Na den na be mo so bi enya stroke, face drooping. Ubon se na nim no a droopy anasa a drop it. Na fa I am numb to the extent say we no be kra as until na nim ho because the nerves na control your sensation on the face no and I say pain response no ni nyina no they have been numbed enye adwuma afei arm weakness won say nensa no I am very weak say they obi free mu a o man nensa so na asa age form no say bi ene nensa no mu nyina ago because the nervous system part na control coordination no you're shutting it down afei speech difficulty omuntimi nkasa slurry speech how to understand until the can see or kasa say so na who sa nyoma miensa so friend 911 immediately because sa nyoma say it's an emergency situation and there are some additional symptoms like dizziness, loss of balance, severe headache, sudden vision loss. Sa nyoma ebe mu hu say nipa no or keka ko stroke mte say we ma online about to now yen ntem e man now saving a life. Yeah, the presentation in Aberry and in conclusion, the American say cardiovascular diseases contribute significantly to deaths related to non-communicable diseases. Non-communicable diseases, area and mwa deba. To say diabetes, nominal hypertension, nominal cardiovascular diseases, hypertension, can hono. Edimwa kutini ye pa. The early detection and lifestyle modifications are key in preventing these diseases and the associated complications. Because of that, you hear knowledge. The BSA updates your knowledge of cardiovascular diseases, the medications and side effects. So that na very good treatment outcomes. Na fe yabo ye ho ban e free sa anwuma ho. Rade mo ya no ma ye ntiase ewo na dum mu nti. Amen.
Yeah, me say ebia a brinty no enya kwan Mr. Questions. And I be okay. You may have 5 minutes now. So we will assemble sa.
On Sano, a week, me pacho on Sabia, it me affecting, and answer your particular hand, it me affecting.
Anetie. Meaning health professionals and was I would be back on one. Sanity, yeah.
Another question.
Yeah.
Okay. You are talking about high blood pressure. I just want to ask if there's a situation of low blood pressure.
Yes,
what
there
are the
is.
symptoms?
There is a situation of low blood pressure. And I know you're deadly cry high one because not there. Usually when your blood pressure is less than 90/60. So called 90/60, it means you are going down to hypertension. And the bow dizzy now be off. Ube traffic crowd. That usually so be obisa na the beep no low sir maninsuo nom before you transport the person to the hospital to seek medical attention. Hypertension so ho. Nipa bi wo ho naturally your blood pressure is low genetically. Ti say microphone no krabu ho hospital doctor timi catch them say only enchine or increasing the salt because you say salt my blood pressure no cause the same doctors allow say increase salt intake so the BP no ebe cause na fe be num so bebre.
My question is a little bit similar to the orcans here no. You talked about sodium num so bebre.
Yeah.
And so increase blood pressure. But Yasa to say yes, and so at least 2 liters a day. So how much water is too much?
Yeah, so nsuo yɛ bibia yɛ nneɛma a yɛkeka new start ne ade no bia ni hɔ nyɛ but sɛ bro so a you are putting pressure on the kidney because the kidney has to filter your blood ti sɛ saa nsuo no kɔdɔɔ so it means that what the pressure nti in a day hwehwɛ mu ame ahu sɛ wofa 250 ml glass na normal glass na ɛwɔ fie na in a day you should take 6 to 8 of those glass and you are okay. The first is nsuo yɛ no nkyerɛ sɛ fa gallon obi tumi fa gallons yɛ na ɔmo de milk egu mu ɔmo tɔn wɔ Costco ne adeɛ 4 liters yi obi tumi nom obi tumi nom about 2 of that. It's too much. The first is nsuo yɛ no you are nkyerɛ sɛ nom nsuo na ɛsan sɛ yɛ nti you are putting pressure on the kidney ebe affect o kidney no the pressure to kidney so be adwuma ebe overworking. And the fact that kidney no say ne ene wo heart ne connected no kidney nya problem wo heart no so timi nya problem nti so the best is to get about 6 to 8 glasses. Abro so cry should be 10 glasses of water in a day.
Dog,
Yeah.
I mean, in treatment, no, my options,
Yeah.
several of them.
Yeah.
But what recommend near the best? Is it because, based on your cross situation,
Okay.
and the Bema Yehuna, as a doctor, you can recommend one which is best for?
A general cross situation. So, for instance, blacks, chrome, how you're black. Now, alcohol hospital, now hypertension, they will never give you an AC inhibitor or the ARBs because you remember me who said it doesn't work so well as far as blacks are concerned. Like Sonopril, I know because you remember me who says Sandro M1 blacks. Here, guidelines, Ghana you see. Okay, Ghana we use it, but research on my said in the black population when they give them those medications and papa. So they would rather recommend the other two, the calcium channel blockers and the diuretics, the amount Johnson, and the calcium channel blockers. And I say, obi onyem, untimi man AC inhibitor, like Sunopro, the account there, blacks intimi fan, obi onyem because a best pregnancy, For those people, there are other medications like methyl dopa, hydralazine, any BOY, the air reserved for pregnant women. Some of these ones, say AC and ARB, and you good say what we may recommend it's not advisable. Or risk factors are the race any or condition say we are pregnant, when you're pregnant, you never determine the medication you should be given. Okay, one more here. And then you have 3 questions. 1, 2, 3. Okay. Yeah, me.
Okay, me that's it. Doc, thank you for the presentation. I'm a patient, but I don't want to disclose much of myself concerning this kind of this discussion. But I just want to support the any point you made about the diet. I mean, the what we can control. I mean,
modifiable risk factors.
I mean, the things that we can control, things we cannot control. The cholesterol, for example, sometimes it is based on your area where you are coming from.
Yeah.
Those of us who come from, Africa, for example, have a lot of issues with this.
Africa, bro.
I mean, this, that sort of thing. But that here too is like more of that type. How can you help us to encourage people to be able to control this? Because sometimes you don't have many options. You just have to choose your food. Like you need to eat it. And that's it. So this is what I want to add to what you said. If you can elaborate a little bit on it. I'll be grateful.
Okay, thank you. Pacho. Sir, what did...
So it was a response to Pastor's questions.
Okay.
You can do the question and then. It was a response to Pastor's question earlier about. Okay. I mean, basically what you said, we as patients don't choose what medications we should be given.
Yeah.
Because there are guidelines. And so if the patient is a white patient above the age of 55, I know the first line in my mind I'm supposed to give. If it's a black patient above 55, I know first line drug to give, second line and third line. So there are guidelines for that. But what you should also know is that the drugs are so many. I don't know if doctor knows all of them because he's a pharmacist, but as a medical doctor, I don't even know all the drugs for hypertension. And so I'm saying this to let you know that if you are given one medication and you're experiencing side effects, you can always go back and tell your doctor that I don't think this medicine is working well for me. I'm getting headaches on it. One of the medications we give black people as first line, calcium channel blocker, amlodipine, nifedipine. We are sure some people are even on it here. It's very notorious for headaches, very notorious for leg swelling. So if that bothers you so much and you tell your doctor that this is not working for me, then we can change it to something else. And so don't follow people and say that, yes, and then you stop taking your medication. You will get a stroke and you will die. Nowadays, we don't even pamper you anymore. We'll tell you as it is. If you stop taking your medications, you will get a stroke and you will die. So if you have a problem, please, and please again, always go back to your doctor and say that, Doctor, I'm saying, Drew, me shasi no. When we say me fabia na me nisuchini me, then depending on what we think it is, if you are dose near too high, na ya teso na idrona na emboa, then we'll change it for you. Amen.
Amen. I'm so for question de me here no that I know bad. Also for question de me here no that out. Oh, when your man tell me, we're sorry about that. Okay.
All right, thank you very much, Doc, for the presentation. My question is simple. Yadia noa, musi enia no adru no, a mo soso no. Eye intentional ana se kwan adenti ne ntimi nya adru ma no, because my challenge ni say yadia kakraka ti say AC by. Chese kan wa na wu. Ene nya adru ma AC. Eba diabetes, eba hypertension, no mne ne o kan dia, yes ye chronic. We manage. Eye no kre ana say intentionally. And I'm a person who manage. I want to find a solution to it. It beats my mind when I sit down and I reflect on it because yadia who do be breba ebola no mni adinira hu enso nyame adom mo anya dura ye di treating the kama. Now other ones here enro nyina onom kra anya adwuma. Na da bia no ara se increase dosage and I say bibia ti sa ntimi pa cho treye mu. Thank you, sir.
That's a very big question. Any last question? It's a very big one. There is this conception, say, whether conception or misconception. Say the pharmaceutical industry, and I say they want to use some strategy, to get money. There is some truth in that. Me challenge you about that. Some diseases be upon man. Can say intentional, or more person solution, but what goes into bringing out one drug molecule? A drawback could be the research that goes into it before it comes out. I'm saying 10 years ago, they had $3 billion. Now the new estimate from the about in 2026, I'm saying it's about $8 billion to research over call lab, I call synthesize a drone at the about at the drone lab animals, rats, and yeah, the way injected rats, I check it how the drug affects their heart, their brain, most body functions. Obey so anyone in our lab. We go cry. If you lab hankasa, emma into humans, no aboka. She said 500 million now would drew ya. You go back to the drawing board to design another molecule to come out with something different. So before say ube break it through abenya the exact molecule to me target this area no. Na enu ho no wa boka billions of dollars. And obi anywhere oye business opese e kan kwan opese obo. Mama correct bibi na say HIV adro yenya. HIV adro yenya ni nyina antiretrovirals no. Ni nyina no reduce the viral load. E reduce viral load. So o ja adro no ma viral load no be san shoot akọ up. Ama yare no be san escalate. Ubenya all the complications of the HIV. Ti sana ye nyina ebenya na nke nya no adro. Say ye papa nom ne ye nananom ebi so osa yare bi. Ye pepa seka ye benya anu adro na ke tu ase once and for all, but it's very difficult until na ye border ro say ye ma lifestyle no ho hian so lifestyle no ho hian a ebete or ano so pa because this is an enterprise, a business until obi en ho be invest billions or be expect to say until where new drugs na eba no they are very expensive. We show hypertension no near the new molecules aba most of them Oko Ghana insurance and teaming cover. The boarding 1 month a drobia obey ye bear 3,000, 5,000. And son wait to many 1 month a draw personia. If you want the innovator brand, the original molecule, no mayana. But with time after 10, 15 years, some we generic types. I no a bono other companies to me be my bono because we are drono and now you have 15 years to sell to recoup whatever sika or the shame. Obi koye obi born ho musoko wia no koye bia wait me na court. But after 15 years na nipa no watimi atene kana ko animo no ye ma other companies kwan mo ye bia e born timi ba for the friends generics. And it true say there is some business aspect of this whole but then ye nyina e benya nanka ye timi etu ase but ye ntimi so forgo the business aspect so more year and mocha. Yes, yeah, tear so from that perspective. Yeah.
James questions in analyst.
Me patcho so question bi a call a lunch you wait me ehumi na yakasa.
Asafu so bohu. Enti I'm Zahana yedi. Oh.
So baby and Cassane. And I say hypertension and my man on morning tea.
Yeah, that's it. Me pacho media no new question. Na last year about October me be ko Ghana and I me ko broad work say sa na friend US. Me ko no and result no buy no and me diabetic anyway. And now I say me sugar no akosoro. Enti me no metformin. Sorry. Me use metformin. Enti omo de medication bi kan ho. Enti medication no me say a new medication aba. Any system me a new one aba. And the question me emergency me sorry doctors Yamoah have me emergency me no more drone no. Enti pharmacists now they pharmacists now me ko je drone. You know, I'm say monocra. Mentia no up to now I make a say. Enti me koso no me formen no. Enti me ba January no na me wo US na ye wo food supplement and I say bi nyina ye nuane nro. Ye free company no relief. Na me ne wo mo eye adwuma. Enti me ka say me ye wo weight loss. Person me coach. Now person me coach. I just go through weight loss. And I me register. Until me cutting it short. Me weight loss. Me either 20 days or 40 days. Now me pesa me so better pee because me so be free. Inti me ye be 10 days no. And I me cut it and I me ye ne ka ho nyina. Inti because say na me sugar no wo high no. Doctors catch me say 3 months time. Me mbransa me ye test bi. Inti na mo US no mo frɛ me. And I me see me ni ho no. Omo mama no that date me see be do ho na me buy. Inti ebeka be week am me free a US no na me senka me kwa no ma ringe. And omo the appointment bring me US. Inti me go through yard already no me book me take it so I me call Ghana 21st. Na my appointment here 22nd. Inti na yes March na yes me change take it na me call here test no me tia omo ni say me call here test no buy no. 1 week me ringe here no the omo ka kire me and say adie bia me here no me nko so na me nye na sugar na perform say omo de me ato pre-diabetic. Enti me hunu say senia mo kan lifestyle betimi aboa sa weight loss ayi na me ye no exercise man ko gym da nya exercise bia but e nuane ne ade ene senia we control we very good aboa menti me hunu sa no so ye bi.
Amen.
Ono so ye no ono so the sugar no aba form ono so nyame ayadom ama we nyina aba enti ebia so bi o ba wo struggle with that actually no omi ani ayebetimi edin komo me da mo se.
Amen. Yo, yada aboafo nyina ase. Elder, over to you.
Time intino. Enti ilibisi ya. Sorry for that. Nti ye nyina be ma yemuso. Doctor yada wasi ewo nimdie sonko a odi amaye any questions ye bi se nyina ye nyina so ye betumi asua bibia fim se na be ya be boy ankasa na ebitu ye ya ye hu kwan ye fa so ebetumi ale atuti ye most of time nye no nyina na na e boy but se wa ankasa hu wadi die ye ne nema bi kaka rotumi ye ni ya itimi reverse die e bia eko so woni padua na mtuni edan mi asese wa maye ndifo a omo wa safi mo mo boy sa kwan so bra ye frɛ nyentofo na bed ma ye nyina be sori na ye fa ye nyuni ato 254 didi kan no ene de etwato 254.
Pacho, Mama Mompai. Yamani Abankese, Yada was say, a way so, one nam doctor so, a church yen, a fire pomo dear. Yes, slow sense, some yatin a way, but boy, Nemaye or strong or dear. Ye bit to me a tears and some way, na yedia ye druma. Said ye beya ye benya warding, na ye to me at nase, edia sumo, no cremo. Inti ni esra on the say, Brani be shrayen, and a day. Na yen fat as samui, and some fama a fofro. Na fe yenya warding, say yan shay a pomo din su ya. Yenim se be bon ho akonta. Inti ye so se be my osra warding a ye be to me dia yesa. Ye free word ni mo yi, ye so si shrayen, ne boy ho ban. Na yasa bi chiemu enwumre. Na yede adisua so asa to aso yeda wase so waye ne sama ye wo Yesu Kristo din mu nti amen
Amen.
Agirifo yeda mu nyina mo ase se monya emre na motie adisua ni nyina quick announcement ye mre no ko ndi nke hwe program no so anka 115 ene nke ye ba but said ye mre no ko ni nti no ye beshed next program na say 140 it yes stress ye free ha ye go straight to the cafeteria na ye nko didi enim say we didi we apesa ben nam kakra betwetwe mu kakra nti 140 ne ye hye ase na program ne ye 10th anniversary be gidi say ye dwumade ye bi nyina no ne hia the 10th anniversary no ye ba be pa ho ntoma after lunch no 140 ne ye hye ase na ye wia ye sanso ba be ye big program a men pesa oba mixi questions wo efa akwanhwefo asafo no ho anase nyamesum mu Kristo sum no osofo ewo ha osofo bebiri wo ha omo beboa na ya nya ntiasie ewom nti ye stress ema ye mixi sa program so nti no yenko didi 140 anyamtofo amomra 130 meshas yantotonyo 140 na mejina ha meye program da munyina amase yebehia 140
Mepacho obi wahana ne nsanka ne welcome pack na omami hu na me fama Uncle Ben okay me de odi ama ena t-shirt no so ayewire say a little bit of salt ebi mu wo ho a omonsa ka omo de dada but